served as a basis for many other studies that came after that I'll share with you. There was the American Cancer Society's study, the Cancer Prevention 2 study, and this was published in the journal Circulation in 2004. This study found that as air pollution increased, there's an increased risk of cardiovascular mortality from 8 up to 18%. And I didn't name it before, but the Harvard Six-City study was published in the New England Journal of Medicine in 1993.
And we can get lists. Maybe you can send me a list and I'll get it on the CCL website.
Absolutely.
Okay.
And then there was much compelling evidence to this point, and so in 2004, the American Heart Association released a scientific statement linking particulate matter exposure with cardiovascular disease risk. And this is particularly important because it's coming from the American Heart Association. They actually came back and had to update this statement to show the effects again in 2010. Then also there have been several subsequent studies as well. There was a Medicare study that came out in the Journal of Epidemiology in 2008 and found regional associations with these in the central region and the southern region where mortality and life expectancy, life expectancy is decreased in areas with higher pollution. And then there's the Nurses' Health Study. They showed a 26% increase in mortality associated with particulate matter exposure, and a twofold increase association with cardiovascular disease. So many of these studies looked at both lung diseases or respiratory diseases as well as heart diseases, but found stronger associations with heart diseases in terms of air pollution exposure. Not to say that respiratory diseases are not important in the discussion of climate change, because it is also very important. They just found stronger associations with heart disease than the ones that I've shared here. And I wanted to share one more with you, and it's actually two. Life expectancy. Arden Pope out of BYU and colleagues, they researched life expectancy across 51 metropolitan areas in the US, and this was also in New England Journal of Medicine in 2009. This one would be a very helpful resource. You can actually go to the website, and on the website there's a great interactive tool where you can look at each city and see the levels of, as you go across. They found that life expectancy was inversely associated with air pollution, PM 2.5 exposure. So the places, once again, with dirtier air had lower life expectancy. But interestingly, they demonstrated that this could be associated with up to 15% of the gains in life expectancy. And they also demonstrated, they came back, reanalyzed again in 2013 and found that even small changes or small decreases in air pollution exposure still had significant gains in life expectancy. So even small changes. And I want to go back. With the six-city study, what was really interesting about that study was that all 6 of these cities were actually in attainment by the EPA's standard for their air quality standards. So that brings it even more important that even small changes, even if your city is under the air quality standards, still have significant gain. You can still have significant gains in life expectancy and other health outcomes. So the question, why isn't this this massive problem an ongoing discussion or ongoing part of the narrative on climate change? Well, these studies demonstrated that powerful economic interests are related to the outcomes of these studies. And I say that, but I'm not saying that these powerful economic interests are necessarily adversely affected, but that's the way the narrative has gone, that to act on this will lose out economically. But as Dr. Patz just pointed out, it doesn't have to be framed in the negative. There are benefits in industry, there are benefits in investing in clean energy, there are benefits and opportunities there. So we need to look at this as opportunities, and then, of course, there are huge health opportunities, as I've suggested through these unfortunate tales of life expectancy and mortality from cardiovascular diseases. So that's one part. The benefits are not well known, and we have to expose those benefits. Another thing, we like to attribute health consequences to our own personal health behaviors. And while that may play a role, when it comes to heart disease, people want to say this person has heart disease because of their life choices, of their diet, their exercise choices. And that is important, but environment plays a role as well. As I've shown from these studies, it could be 5 up to 15% in the case of cardiovascular disease mortality. So we have to change that conversation as well so that we can not look at it as a behavior choice. And this is the benefit of environmental health. We're able to make large gains on public health, on population health, through environmental policies that don't, at the end of the day, require you and I to make many decisions as diet and exercise, although this is all important, bringing it all together. And then just bringing it all together, framing the message, I think it's important when talking with people for them to understand that investing in or acting on climate now can save lives, can improve our quality of life, and can actually extend our lives. So I'll leave it there. I'll open it up to the other panelists. Thank you.
That was a beautiful discussion. Thanks so much. And I wonder if either of the other panelists would like to follow it up. I know that Dr. Patz, earlier you talked a little bit about the economic benefits of, addressing climate change and when you're comparing health impacts, but maybe there's something more specific to particulate matter. Either of you, please.
Sure, yeah. Let me just follow up 2 points that Natasha made regarding the cost and people that are worried about, these regulations will harm their business. Industry was clamoring over the Clean Air Act in the 1970s, and it would cost too much to implement it, and it would kill business, it would kill the U.S. economy. And years later, the EPA was required to do a benefit cost analysis of the Clean Air Act. And I think, correct me if I'm wrong, but the number was somewhere about benefit to risk was 33 to 1 as far as benefit out of the Clean Air Act versus the cost. And I think that this is the same lesson that, people are worried, what's going to happen if you how many jobs are you going to lose? In fact, there are studies that show there are far more jobs anyway in green technology than in fossil fuels, especially coal. One other thing you mentioned I want to pick up on is personal behavior. And I think this is where there's disinformation, intentional disinformation about things, are problems because it's your fault. And it's, it's not a matter of, you told me you would like to bike to work. Yeah. When I lived in a different city before I moved to Madison, Wisconsin, which is platinum ranked for bikeability, I tried to bike to work a few times and quickly realized the risk of biking outweighed the physical fitness benefit, right?
Yeah, exactly.
So it's not about personal behavior, it's about policy and planning so that it's a population-wide, decision. It's not your fault. Think about the littering campaign, the anti-littering. Don't litter, right? You know what that was? That was a campaign by McDonald's and 3M and a few others that were trying to fight these regulations on packaging, excess packaging and all the styrofoam and all this stuff. So they twisted that and turned it into, you individuals quit throwing trash out the window, when in fact, so this is where, this is where policy really matters.
Great, thank you.
I'll end there.
Okay, are you on? You have to turn to the right. There's something small on the bottom.
Oh, there we go.
I think now is it on?
Okay, I think this is now working. Okay, so just something occurred to me as we were talking, which is having gone and spoken to legislators and to others about taking some kind of action to address climate change. You often get the argument that, well, I have so many things to think about. We have these issues and that issues, and we've just had a tragedy in our town, and and very serious things that people are worrying about that can look like somehow they're a diversion away from the focus on climate change. And I think that there's a very easy way to address that kind of argument, should you get that from the people that you're lobbying, and that's that climate change is a threat multiplier. It's a problem multiplier. And so whether we're talking about health or security or the economy or domestic violence or the environment, that in each of those areas, not addressing climate change puts us at greater risk. So with regard to security first, the Defense Department is quite concerned about the security implications of the melting of the ice caps at the poles and what that means for the relationship between our country and other countries across the North Pole. With regard to the economy, there's been this report put together by Hank Paulson, former Treasury Secretary, and Michael Bloomberg, former mayor of New York City, also a prominent businessman, asking that all major businesses present to their shareholders what the threats are to their particular business of the changing climate, so that they have a more realistic understanding of what their businesses face going forward. And if we're talking about, domestic security or violence, there's been a lot of really solid psychology research showing that these kinds of problems rise when the heat rises. And so warmer weather actually contributes to problems with domestic security, domestic violence, community violence, and even international problems, as we've seen in the Mideast. And then, of course, we've talked about the environment and how the quality of the air deteriorates when the weather gets warmer. And so we have greater deterioration in our environment in general as a result of climate change. So on the one hand, we've got the benefit that we can find. On the other hand, we've got this threat multiplier that really requires us to address this issue, regardless of what area we're working in.
Thank you. Thank you. I got one too. So I think we're good. I think we each have one, or we're sharing. We have so many questions. This is so great, and the answers are so excellent. And I think we're going to have 2 hours for a breakout session next year.
Group like 3 or 4 questions and we'll write them down.
Oh, that's great. Do you guys want to glance and see if your names are on these? And then how's that go? There was one question that I think is kind of a CCL question that our Health and Climate group really wanted us to get to. And I think it's important for all of us when we're talking to our members of Congress, specifically in terms of carbon fee and dividend. It's clear that there are ample reasons for Congress to take action on climate change from a human health point of view. We know that the potential economic impacts of taking action speak very loudly to policymakers. So you would think human health would be enough, but we know that it comes down to dollars and cents a lot of the time. The 2015 Lancet Commission on Climate and Health specifically stated that the single most powerful strategic instrument to inoculate human health against the risks of climate change would be for the government to introduce strong and sustained carbon pricings in ways that strengthen over time until the problem is brought under control. Sound familiar? So I wonder if you guys could speak a little bit about frame how the health impacts in terms of economic reasons. And I know we've touched on this already, but maybe specifically how carbon fee and dividend and other carbon pricing mechanisms might play into the discussion. Does anybody have want to talk about that in particular? That's all right. And then I can look through these.
Okay, so, you know, I think carbon pricing is one way to talk about the expense of the lost opportunity of a low carbon economy. And so a low carbon economy, which would be achieved by carbon pricing, can get us further along this trajectory of health improvements in the area of transportation, because active transportation by walking or by public transportation is healthier, it's lower carbon. In the area of food, because if we think about the, raising the price of the carbon that is associated with food production, we're more likely to eat a lower carbon diet. The lower carbon diet is like the Mediterranean diet, and it brings us better health. If we're talking about, power, electric power, then the immediate benefit for resources spent on clean power saves us about $4 for every dollar we spend. So every dollar spent on clean, renewable energy saves $4 in healthcare costs. And the way to get clean, renewable energy is to put a price on carbon. So, price on carbon kind of feeds into all of these policy prescriptions. And I think understanding those connections and being comfortable speaking about them is one way to advance them. Oh, I'm sorry. Okay.
Can I make one follow-up? I just want to mention thinking about the externalities, these external costs of burning fossil fuels to the environment and to health. What industry or manufacturer do you know that does not have to pay for cleaning up its waste? When you make something, part of the cost of it is the, handling the toxics so they don't run into the, it's the Clean Water Act. And, when you put, you have chemicals and you're making them, you have to dispose of them. You have to pay for that. Why, when we burn fossil fuels, and I'm going to paraphrase the late climatologist Stephen Schneider, why do we use our atmosphere like a toilet and do not have to pay for what happens when you burn fossil fuels, the health costs and the environmental costs?
Well, that's great. I've now taken, let's see if I can get my mic on. I think that's a great point. I don't know why we're using our atmosphere as a toilet. I think that's a great question. We have some great questions here, and I can't believe I just now put the panelists to work to organize the, the questions. Just, I'm a natural moderator. What can I tell you? So here we go.
Okay, so there's a couple of things I want to make sure that everybody knows. I see there's a question here about the pharmaceutical industry and also one about Congress and one about corporations in general and hospitals in the health sector. So there's a very vigorous movement going on amongst hospitals that's organized by Healthcare Without Harm and Practice Green Health. There are currently 1,200 hospitals that are a part of Practice Green Health, and they are all working to lower their carbon footprint. They have a fantastic website. If you want to look for it, I think you'll be really impressed. They have a lot of supporters. There are some hospitals that have completely gone to renewable energy. Most are trying to reduce their waste. They're trying to reduce their energy use. They're improving their food supplies so that they're healthier and greener, and so there's a lot going on the hospital side. With regard to the pharmaceutical industry, there's a lot more happening in corporate America than we're generally aware of. So I've gone a couple of times to a meeting of the Association of Climate Change Officers, which is sustainability leads at major corporations. And there are a very substantial number of large corporations that are working to reduce their energy use, to use more renewables, and to decrease their waste. And they give awards every year for those companies that do the best at that. So, you know, please know that those things are happening, and, you know, they're really important trends.
Thank you. Okay, so we do have a bunch of questions, some of which have been specifically addressed to certain people. There's one here that was kind of a follow-up to the particulate matter question, which says, what are the primary sources of health-damaging air pollution, and what is the distance over which they may act, less than 50 miles or greater than 500 miles? Thank you.
So it really depends on how you're looking at it in terms of the health-damaging air pollution. Among the primary sources include industry. It also includes automobile vehicular emissions, be it diesel or automobile emissions, to clarify that. Now, the distance question, well, and I'm thinking as I go, so forgive me. And so in terms of those primary sources, it also depends on what we're looking at. So if we're looking at particulate matter, now I can clarify that. Yes, that's coming from industrial emissions as well as automobile or vehicular exhaust. That in particular, there are different types of particulate matter, and they impact us differently. There's coarse particulates. These are the larger particulates. We're able to breathe them in. They tend to bother our nasal passages. PM 2.5 is the one that we've largely been talking about, the fine particulates. The trouble with those, we're able to breathe those into our lungs. And the problem with that is once it reaches our lung, it can cause impacts directly on our lungs. This can also cause cardiovascular impacts. That's where it's linked with cardiovascular disease. So it can cause changes in our breathing rate. It can also cause changes in our blood pressure and many other things. I don't want to bore you with too many details on those. That's the problem with the PM 2.5. We can breathe it all the way into our lungs. Then there are ultrafine particulates. People that live closer to a major roadway are more likely to be exposed to these ultrafines, and they're the more harmful ones. They're actually able to go into our lung. Once again, they're able to reach our bloodstream and possibly able to reach our brains. So particulate matter can be particularly harmful to our respiratory as well as cardiovascular systems. And so then those distances. So I'm looking at these distances. I'm thinking mostly of distance to roadway as I'm looking at it. And people that live closer to a major roadway bear more cardiovascular risk and have more risk of mortality associated with this. And this is largely through those tailpipe emissions, as explained before, but there's also road dust. Oh, I see a time card. I should let the other participants weigh in here as well.
So a couple things. One is that we did some surveys, national surveys of physician societies, including pulmonary physicians, that's lung specialists, and also allergists, and also National Medical Association members. And we had an extraordinary number of comments from the lung specialists about the impact of forest fires hundreds of miles away from where their fires were actually happening. So people told us, we asked them for anecdotes about their own patients, and they described having their patients who had asthma or chronic lung conditions go to the emergency room or be hospitalized because of fires that were happening hundreds of miles away. So, you know, that's something that is obviously very relevant here and shows how these things can spread. But I have a number of questions here about where you can get information about the quality of the air, and I want to make sure that everybody knows about the American Lung Association's State of the Air app. This is a smartphone app that you can download for free, and you put in your zip code, and it tells you on a real-time basis what the state of the air is. It's the State of the Air app. It's put together by the American Lung Association. And last week here in the DC area, I was driving home and I thought, gee whiz, the air doesn't seem quite right. And so I whipped out my State of the Air app, and sure enough, we were in the orange zone. You know, there's green, yellow, orange, and red. And so we were in the orange zone for ozone, and we were in the yellow zone for particulates. And especially when the weather is warm, there are many places where the quality of the air may not be exactly what you would think. Another resource there is called airnow.gov, and so you can put that address into your computer and also find out right there on that day what the air quality is, not just where you are, but even around, you know, across the entire United States. And when you do, if it's a hot day, you'll often see that it's yellow across an entire region of the country. So that's really important. And one other thing is that there's a number of questions here about mental health, and so I want to make sure to tell everybody that the most recent report called The Health Impact of Climate Change in the United States, and the web for that is health2016.gov. And that is the most recent report from the Climate Change Research Group. And it has information about the mental health impacts, about the impacts on the air, and various other things. And so mental health in particular has some, you know, there's some very significant impacts, especially when there's adverse weather, extreme weather, displacement. Children can be dramatically impacted, and sometimes for long periods of time. PTSD can be a result, substance abuse, and sometimes these things can go on for a much longer time than, you know, than might be thought. So there definitely are mental health implications here. There are publications about it, and some of it is summarized in that report that you can find at health2016.gov.
Great. I have 6 questions here that I'm going to answer, I think. Because, they're related, so it's really going to be 3 answers to the 6 questions. One question is about public health professionals getting involved with urban planning. Is it theoretical or is it happening? It's happening big time, and it's been happening where the public health professionals have been welcomed with open arms into urban planning, decision-making, and so I encourage anyone in public health to meet with local officials, because there's been great understanding of the potential benefit from that collaboration. It's been really nice to see that. And then as far as documenting benefits of urban design, I'll just mention that we did a study for the upper Midwest region, and we asked the question, if short car trips, less than 2 miles, were taken off the road in urban areas, and if they were replaced by bicycle trips, and only in the summertime, not winter, just summertime, what would the health benefit be? Well, from the reduced air pollution and from the increase in physical fitness, you would save about 1,300 lives every year, just for our region, and just in the 11 largest cities. And also, that equates to $8 billion, with a B, $8 billion in avoided mortality and health costs annually. So there are studies like that. Also, if you compare cities with the best bikeability and the most participation by bikers for commuting to work, comparing the best biking cities to the least, there's a difference of about 25% in the rate of diabetes, obesity, mental health, cancer, across the board, all of these, you know, and you can see this. You can see the data. So absolutely, urban design makes a big difference in health. I got questions about cost savings. How good are these studies? And I'll just cite, tell you they're very good studies, the ones that I showed this morning, and you can look at the data, the literature. There's a growing literature. The latest study out of MIT, published in Nature Climate Change in 2014, showing that the health benefit might be 10 times greater the value than the cost of clean energy. These things are more and more, they're quantified. And finally, 2 questions related to, comparing all the different health issues of climate change, from air pollution, heat waves, mosquito-borne diseases, famines. How do they compare? That's a tough question. A lot of there are studies that show that the 9 million people at risk of hunger today could double in just 40 or 50 years because of heat stress in the tropics. That's a big issue. But the issue I talked about when I said it's the iceberg under the tip of the iceberg of forced migration and refugees and basically destabilization of society, impossible to study, but that could be the biggest issue. So my one take-home message is, when you talk about climate change health risks and someone says, oh, you're studying malaria, the effect of climate on malaria. Well, it's more important, the land use change or drug resistance. And don't focus on a single disease. The point of climate change and health is that there's so many pathways, the direct heat waves, the precipitation and flooding, and there's so many ways climate change affects our health that you can't just pinpoint one. You need to talk about them all. And the final question was, are there other countries, will be harder hit? And my main message there is, thinking about who caused the problem. Those countries most vulnerable are the least responsible for causing the problem. So it's a huge ethical issue. And Pope Francis has picked up on this, and Dalai Lama has picked up on this. But we live in a globalized world, so increases in disease anywhere in the world affects all of us.
Oh, that's great. I am just amazed at the answers that came from here. I mean, we have had like the dream team of health experts here. I mean, really, really incredible. And we have so many questions here, and I'm getting the time thing. I'm wondering if I could take some of these and put them together in a way that I can try to get some answers, if people are willing to, and then get them out to people. Let's give everybody a great hand.